guys, this is Dr. Tembeka Puleni, family and cosmetic dentist. Today I'm talking about halitosis, bad breath. What causes it? People who breathe through their mouth due to sinusitis as well, the mouth becomes dry and then they have bad breath. And for people who can't close their mouth, it's either because the tongue is always out or their teeth are out of the mouth, they can't really close their mouth. Their mouth becomes dry and then they also have a lot of bad breath. Well, we know that if you don't brush properly or floss, then there's food that gets stuck in your teeth and then cause irritation in your gums, causes bleeding, then your mouth starts to bleed. And then when it bleeds, it causes the bad breath as well. So it's important for you guys to brush your teeth and floss. Brush your tongue as well, because that's where most of the bacteria that are being stuck. Even the bleeding, the blood that bleeds when you have gum problems, it gets stuck in the tongue and then that causes halitosis, the bad breath. Smoking as well. Smoking, it affects your taste. It causes the bad breath. It makes your mouth to really smell really bad. So stop smoking as well, because it also affects the smell of your mouth. And then we have diet as well. Too much acha, onion, garlic, and some certain spices. So much of anything we know that is not good. So is the other food as well, because it gets digested and then it goes through the bloodstream, through to your lungs, and then when you breathe it, you feel your mouth smells, your mouth smells bad because of too much of that food. So avoid that as well. If you're not sure if you're really eating that, just keep a record of that or visit a dietitian or your dentist to check that as well. And the infections in the mouth, that includes your gum disease, your caries, the teeth that is rotten. It also affects your bad breath as well. Sinusitis, sore throat, tonsillitis, it affects your breath as well. Then you have a bad breath or halitosis. So make sure you visit your dentist to check your teeth if they're not rotten, if you don't have any gum problems. But every time, if you bleed every time you brush your teeth, you must be concerned. That means that you might be having some gum problems. Tonsillitis as well, or sinuses, also it affects your bad breath. And then it's common that when you wake up that your mouth smells bad. For everyone, it smells bad, but for people who are having tonsillitis, it's even more. And for people with diabetes and certain diseases, it also it is more prone for them to have a bad breath. It is because there wasn't much saliva being rinsed throughout the mouth when you were sleeping. So without the flushing of the saliva in the mouth, then you accumulate this bad breath. And also on the tonsils, there's also that small yellow granules that normally form, especially in guys. It happens that when you wake up in the morning and you're coughing, you see like the small granules coming out, and you don't understand what that is. It's normal. It happens, those bacteria that form in the tonsils. So it is important as well to use a mouth rinse or warm salty water to gargle all the way to the throat to make sure it's clean and to remove all the bacteria that are there as well, so that you have fresh breath as well. And then we have medical conditions. I did mention diabetes earlier. Diabetes, because it affects the salivary secretion of your mouth. So you find that your mouth is dry. So people with diabetes tend to have a dry mouth, yes. And then people with Sjogren syndrome, where there's the salivary gland is affected and is not secreting enough saliva, then the mouth is dry. Or people with just dry mouth, whether it was due to cancer or chemotherapy, then they are more prone to having a bad breath because there's less saliva being secreted by the salivary gland and the mouth becomes dry. And then when it's dry, then it smells a lot. You also find that people who breathe through their mouth due to sinusitis as well, the mouth becomes dry and then they have bad breath. And for people who can't close their mouth, it's either because the tongue is always out or their teeth are out of the mouth, they can't really close their mouth becomes dry, then they also have a lot of bad breath, because the mouth requires the saliva to keep it lubricated and fresh and clean. But if there isn't, then it becomes dry. When it's dry, then the gums bleed, and the bleed, of course, you definitely have a bad breath. So it is important that you take care of your mouth, drink a lot of water if you know you have those conditions, diabetes or any other disease that affect the salivary glands. For those with teeth that are out of their mouth, see the dentist to make sure that they get braces or orthodontic treatment to fix that. But if you're not sure what causes your mouth to smell and you've tried everything, it's best to visit your dentist for a checkup. And also, people who sleep with their with their mouth open, they tend to have bad breath because of the mouth getting dry. Because there isn't much saliva secretion, so they end up having a bad breath because the mouth becomes dry to the open mouth throughout the night. And then for people with gastroesophageal reflux, where there's a reflux from the stomach, chronic reflux, where they find themselves like they're vomiting or they eat a lot, and then they end up having that gag reflex, and the secretions or whatever the liquids in the stomach tend to come to the mouth a lot. They tend to have a lot of bad breath. So if you are somebody who knows that you normally get that nausea, gag reflex more often, you also have to look at that as well. Check on what you're eating, what causes that gag reflex, because it also affects your mouth as well. Every time the liquids or the acid from the stomach are introduced to the mouth, they are more concentrated and they are more harsh to the mouth, and then they burn the mouth and it causes halitosis, bad breath. Also with the babies, you find that the nostrils, the noses are always lodged with food and they're not cleaned properly. Obviously, the kid, you find that the baby is now having a bad breath, but it's because the nose is also not clean. So check the babies as well. If their noses are clean and there's no blockage on the nose, because it also affects the mouth as well. There's also some medications that causes less saliva secretion or affects the gland from secreting enough saliva. You should also take that into consideration. You'll notice by the fact that every time you take that medication, your mouth becomes dry, or some people experience their eyes being dry. So some of those medication, they affect the mouth as well, because like I said, if your saliva is not secreted adequately, then your mouth becomes dry, and then when it's dry, then it's more prone to smelling bad or having halitosis, and also affecting your general health of your mouth, because you'll have dry teeth and dry gums, and therefore the gums will automatically bleed, and also the teeth will get rotten even much quicker, and thus causing bad breath as well. Yeah, that's it. I hope it covers most of the things. But if you're still not answered as to what is the cause of your bad breath, please visit your dentist to have a checkup. Drink a lot of water to clean your mouth. It's important. Brush, floss. Make sure you floss and you brush. Make sure that there's no teeth that are rotten in your mouth or having cavities. Your gums are not bleeding. So make sure you floss. If you're flossing and you're still bleeding, please visit your dentist. It is recommended that you visit your dentist twice a year. That is every 6 months or biannually, whichever way you prefer to call it. Brush your tongue, brush the back of your teeth, brush your cheeks as well. So guys, make sure your oral hygiene is up to date. Make sure you brush, you floss. Okay, you floss first, you brush. You use fluoridated mouth rinse. You brush your tongue, also at the cheeks as well. You check your medication, whether it has the side effects of having a dry mouth. Stop smoking, it does affect your mouth as well, and your general health as well. Drink a lot of water. Check your diet as well. Visit a dietitian or a dentist to check how your diet is affecting also your halitosis or your bad breath. Visit the dentist twice a year. This is every 6 months or biannually. For those who are wearing dentures, remove them at night, brush your teeth, floss, and then put them, and then make sure you clean them, and then put them back in your mouth. Make sure they're also clean as well. Oh well, after removing tooth, it's normal that your mouth will smell because of the blood that is in the mouth. So don't be too harsh on yourself with that one. It's normal. So after you remove a tooth, give yourself a week to recoup. But then if it still continues, please visit your dentist. And then just sip a lot of water, drink water throughout the day. So instead of having your sugary drinks, substitute that with water. Water is more effective in keeping your mouth clean and fresh, so that you can have a good smelling, fresh smelling mouth as well. Or breath, whatever you want to call it. So guys, thank you. Thank you for watching. I hope I've helped you solve some questions that you had in your mouth, in your mind about your bed, about the mouth, the halitosis or the bad breath. But if you still have more questions, please comment below, then I'll be able to answer your questions. And don't forget to subscribe, click on the notification button so that you'll be the first one to receive every video that I do. Like, comment, subscribe again. I've said that, but please again subscribe. And more importantly, please take care of your teeth. Check the other videos on how to take care of your teeth, of brushing and flossing, and also visit your dentist every 6 months. It's really important. Or every time you have a discomfort in your mouth, or there's some uncertainty of what's going on in your mouth, just make sure you visit your dentist for a proper checkup and a proper diagnosis of your bad breath or your teeth in general. See you in the next video, guys. Bye.